Alcohol use disorder and anxiety are present about 50% of the time in combination. So 50% of people with alcohol use disorder will have anxiety and or depression. So the reason anxiety is common in this group of drinkers is that there's several reasons. So the most obvious is that alcohol withdrawal itself is anxiety producing. And so sort of the mildest form of alcohol withdrawal is a hangover or a bad hangover. But when you get to a certain amount of drinking, it then can progress from just a bad hangover to shaking, heart racing, sweating, nausea, lots of unpleasant physical symptoms. However, you also have very unpleasant psychological and mood symptoms as well. So that during a hangover, during alcohol withdrawal, the anxiety goes way up. And the reason it does is alcohol is a depressant, and withdrawal from any substance, you can pick any of those drugs out there. Withdrawal has the opposite effect of what the substance has. So alcohol is a depressant. It probably lowers your blood pressure and heart rate a bit. You feel calmer. So when your body's used to it, like, hey, I got to get that every day. But when you don't get it, you have the opposite effect. So you get a lot of anxiety.
That's really interesting. I never thought of it like that. Wow.
Yeah. So that's a real cornerstone whenever you do a medical evaluation of someone with alcohol problems, is to assess their alcohol withdrawal risk. The reason is more severe alcohol withdrawal can be life-threatening. There's a thing called delirium tremens, which is unusual, but it's basically eventually your body can't maintain its blood pressure or heart rate properly. And that's what really kills people with delirium tremens. Now you hear the word alcohol withdrawal delirium a lot, and not all alcohol withdrawal produces delirium. There's a lot of alcohol withdrawal that are in an intermediate zone where it's mostly shaking, sweating, nausea, high blood pressure, anxiety, insomnia, um, and that a number of those folks will progress to either perhaps having alcohol withdrawal seizures or could progress to delirium tremens. And in general, it's on a time course. So 48 hours after your last drink, you're at risk for alcohol withdrawal seizures. 72 hours or more after your last drink, that's when the risk for delirium tremens comes in. And delirium tremens is basically what they call it an alteration in your sensorium. What that really means is you can begin to feel things, bugs crawling, see things, so visual hallucinations, and then also hear things, auditory hallucinations, and you get disoriented. And that's basically what delirium is in general. The data we have in reducing alcohol use is based upon numbers, and the number we have best access to are breathalyzers. So you, in real time, you give a breathalyzer, and via the digital interface, literally via Bluetooth, you download an app. The app's on your phone. You set up Bluetooth with your breathalyzer. You blow into the breathalyzer, and literally the data gets entered, and something that your coaches and your medical team can review in real time. And it's not meant as a way of checking up on you and getting you in trouble. It's really a way of keeping you accountable and giving some real data. And so you can better understand the patterns that you fall into when you're drinking.